tools going to the 6 feet?
Hi, we're continuing to work on our patient, doing some hairline work. Right now we're trying the grafts. It appears that the single hair grafts are going in recipient site 0.5 millimeters in size, and the 2 hair grafts are going in 0.6, and the 3 hairs are going in 7s, which is really, really great. Let me show you what I'm doing to create hairlines. I've already started creating these little triangles of these little zones of where I'm going ahead and making these little triangles, and this is what gives it a really natural look. I'm actually, you see the angle at which I'm making the hairs. I'm making his widow's peak go a little bit off to one side, which is the natural way, and you see that I'm going ahead and making these little zones where these single hair grafts are going to go. And now this is where the ones are going to go, 0.6 please. And this is where the 2 hair grafts are going to go. So you see I'm like in the 3rd and 4th row. And I'm working between his existing hairs. And you'll see that I don't evenly space out these little triangles. Here's a triangle, here's a triangle, here's a triangle, here's a triangle, here's a triangle. And I'll actually have these little triangles. Some of them will stick out a little more than others, once again to give them a totally natural look, which is what, you know, patients want and what they deserve. 0.5. So you'll see, for example, I'm going to make this triangle stick out a little bit more, and while this one will be more contained within the existing hairline the hairline that I drew in. So I'm making these little zones of these 0.5 millimeters where the single hair grafts are going to go, a little bit of angling, and I taper it into where his own natural hair is. 0.7 now. And here you can see I'm just going ahead and filling in little patches. And I wipe it away. And that's essentially what we do to create a hairline. So 0.5. Now to further make it uneven, you see I've already created these little triangular zones. Here, 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 but then I'm also going to go ahead and now make some irregular hairs in between them, so it really throws things off, and of course gives the most natural look, which is, you know, having studied these, you know, hairlines for years, you know, I understand what constitutes a normal hairline or a natural looking hairline, and it's this macro irregularity coupled by micro irregularity. And you can see I'm doing this. This is the micro irregularity. And that's it. Thanks. So we're going to start planting. This is Dr. Epstein working on a patient.